The contents of the lab report are meant for educational purposes only
and are not to be misconstrued as medical diagnosis or treatment advice.
Thanks. Today, on the lab report, Dr. Joe Pizzorno.
Wow, talk about a legend.
I'm a little starstruck. I hope I can keep it together.
Dude, I'm nervous. The world of medicine can be challenging. Clinicians and patients are always looking for more options, more effective treatments, and in the end, more answers. Functional and integrative medicine focuses on addressing root causes of disease. Here at Genova Diagnostics, we've watched this field evolve and grow for over 35 years. We've not only adapted, we've led. Join us as we talk about functional medicine, laboratory testing, and optimizing health. Welcome to the Lab Report.
My arms are shaking.
My
All of
quads
them.
are aching.
Aching and shaking.
Exercise will kill you.
Hello.
Hey, Michael Chapman.
Hi, Patty Devers. How are you?
I'm doing great, except for being really sore from exercising.
Understandable. Is this going to be the last time we do this?
Yes.
Okay.
Welcome to the Lab Report.
Welcome, everyone, to this podcast brought to you by Genova Diagnostics, where we talk about things like functional medicine and specialty lab testing, integrative therapeutics, and how to exercise appropriately.
We should really pay attention more to these KOLs we speak to. But if you're new to the show, welcome. And if you're just returning, welcome back.
Yay.
We hope you went to iTunes or Spotify and subscribe to the show. Maybe rate, review, leave us some feedback there.
Those things help. Those things
do.
really help our morale. You know, sometimes you're having a bad day, and then you just go back and you read one of these reviews, and you're
Right.
like, that's awesome.
It's so true.
Hey, thanks out there. And it helps like our search engine optimization or whatever that is, but really it's for our morale, and we appreciate it. And if you have additional feedback, you can always send that to podcast@gdx.net.
Mm-hmm.
That is the email address, hence the @ sign. That's what those indicate.
Look at you.
I know, I'm a whiz.
Well, I know we're both somewhat nervous today because we're speaking to a legend with a lot of gravitas.
Yeah.
Dr. Joseph Pizzorno.
When it comes to gravitas, I mean, especially in the naturopathic community, I don't think it gets any more gravitasian.
Michael, is that word in the dictionary?
It is, Oliver. Look it
It
up.
is now.
Look it up.
Dr. Pizzorno is one of those men who's actually responsible for naturopathy even still being around.
Yeah, he's played a huge role in the resurrection of this profession when we're at our most dire moment. And he goes and talks about that story a little bit and how we kind of arrived there and dug our way out. And he was there all along. I mean, he founded Bastyr University, so it's pretty incredible.
Well, additionally, his textbook is kind of the Bible that helps me when I came here to Genova to
Is that
really
so?
understand functional medicine.
Is that so?
Yeah.
Interesting.
Very grateful to him.
Yeah. Well, I mean, and we could go on for hours
We
probably with his just celebrating Joe Pizzorno.
His legacy. Yeah.
Let's instead let's talk to him about his legacy.
Call him up.
Oh, that's brilliant.
So Patty,
What?
today we have on Dr. Pizzorno.
Oh, I know.
you know that?
The legend. Yeah.
Dr. Joe Pizzorno is a transformational leader in medicine. As founding president of Bastyr University in 1978, he coined the term science-based natural medicine, which set the foundation for Bastyr to become the first accredited institution in this field anywhere in the world. This validated that medicine which promotes health rather than primarily disease treatment could be credibly taught, researched, and practiced. As co-author of the Textbook of Natural Medicine, he helped establish the scientific foundation for health promotion medicine. With over 100,000 copies sold in 4 languages, over half to MDs, it's not only helped reestablish naturopathic medicine as an important part of the healthcare system, but also provided the scientific foundation for the transformational fields of integrative and functional medicine throughout the world. A naturopathic physician licensed in Washington State, educator, researcher, and expert spokesman, he is editor-in-chief of PubMed Index IMCJ, board chair of the Institute for Functional Medicine, founding board member of American Herbal Pharmacopoeia, and a member of the science boards of the Heck Foundation, Gateway for Cancer Research, and BioClinic Naturals. He was appointed by Presidents Clinton and Bush to 2 prestigious government commissions to advise the president and Congress how to integrate natural medicine into the healthcare system. And he is author or co-author of 6 textbooks for doctors, most recently the Clinical Environmental Medicine, and 7 consumer books, including the Encyclopedia of Natural Medicine, and most recent, The Toxin Solution. And with that, thank you so much,
Welcome,
Dr.
Dr. Pizzorno.
Well, thank you for the kind introduction and the opportunity to chat with you today.
Absolutely.
Well, Dr. Pizzorno, we are honored to have you here. You have such a tremendous legacy, not only as a pioneer for naturopathic medicine, but also as a spokesperson for the entire field of integrative medicine. What has it been like to watch naturopathic and integrative medicine evolve from its early beginnings?
That's a really, really good question, because I've been involved now in medicine for literally over half a century.
Wow.
I started working in conventional medicine research way back in June 1970.
Wow.
So it's been a long time. So I've had a chance to kind of watch how things have changed over time. And I have to admit that we've been more successful than I expected. Way back in the early 70s, when I first learned about naturopathic medicine and then became a naturopathic doctor, it was pretty grim for this whole field. There was just not much support for it at all. Mm-hmm. And in many ways, I started Bastyr just to keep it alive, because at that point, as you may know, there was only one school of naturopathic medicine left in all of North America. I mean, the AMA had won. Wow. They basically destroyed the profession, delicensed most of the states, got rid of most of the schools, but they couldn't quite kill us. Because I'll quote Dr. Bastyr. I'll tell you where this quote came from. So way back in 1973, I was a third-year student, and we were going on an herbal walk with Dr. Bastyr up in the foothills of Mount Rainier. And it was such a kind of a miraculous time, because we were walking with Dr. Bastyr, and he'd show us these various herbals, what they looked at like the environment, talked about how to harvest them, then talk about patients he'd use them for successfully. It was just wonderful. Mm-hmm. But 3 days before that herbal walk with Dr. Bastyr, the Supreme Court of the state of Washington had decided the naturopathic doctors did not have the right to diagnose or treat disease. And so I said to Dr. Bastyr, I said, is there a future for this medicine? And what he said was, no matter the obstacles they place, the truth of our medicine will out. So kind of paraphrased Shakespeare.
Wow.
So it's the truth of the medicine. And they couldn't quite stop us, because the foundations of what we teach, what we practice, is true healing.
Yeah.
That's profound.
And it's just amazing how it has spread, not only within our own naturopathic community, but through the conventional community, and how many conventional doctors have now taken up, whether it's through integrative or what's called functional medicine, they've taken up a lot of these, at least some of the ideas and some of the therapies that we talk about from traditional naturopathic medicine.
Yes. Yeah. Yes. You realize that, virtually all the MDs are in medicine because they want to help people. Yeah. And, and there are many areas where conventional medicine, as it is right now, is great, miraculous, no question about it. But when you start getting into the day-to-day issues of health, how you get people back from chronic disease, how you prevent chronic disease, you start realizing pretty quickly that the conventional model is very, very limited. And where they're most limited is where we're the strongest. Yeah. So more and more MDs are realizing that they've got to learn after they got out of medical school. As a matter of fact, you have to unlearn a lot of things to learn in medical schools, because they were mistaught in the areas of nutrition.
That's right. That's me. Well, are you optimistic that it will continue to see more acceptance from the conventional medicine collective?
Oh, absolutely. I mean, you look at the growth of integrative medicine, functional medicine, and even talking to more and more MDs who are starting to question this. It's very clear. The medical doctors, a big chunk of them, are coming our direction.
Yeah. Well, shifting gears a little bit and talking about everything that you've achieved, I mean, it's just amazing, the tremendous amount of things, the tremendous work that you've accomplished. Did you ever expect to be where you are right now and having done all this with your life?
Well, no, because, I was kind of looking at one problem after another that had to be fixed. Like, we had to get great education. We had to do research. We needed a modern textbook. When I was in naturopathic medical school in the early 70s, the most modern textbook in naturopathic medicine at that time had been written in the year I was born. Mm-hmm. So it was like almost 30 years of new textbooks. So I just basically wanted to keep it alive. I did not realize how much success there would be, but also realize I've been at it now for over 50 years. Mm-hmm. So kind of doing kind of one thing at a time. When I look back and say, "Whoa, wow, 7 books for consumers and 6 textbooks for doctors," and it kind of adds up.
Right. Yeah. Well, that long list of accomplishments, which of those do you think you're most proud of, kind of as a legacy?
Thank you for warning me you're going to ask me that question because I hadn't thought about it. And the two that come to mind, one would maybe kind of obvious, the other one maybe not so obvious. And that is, number one was showing that there's a scientific foundation for this medicine. Up until we wrote the textbook of natural medicine, and the first edition had 1,000 pages and 10,000 references. Okay.
Wow.
Until then, there had been no systematic documentation of the efficacy of natural medicine.
Yeah.
So that fundamentally changed the game because all the naysayers were, well, you're not scientific. Conventional medicine is scientific with capital S, and if conventional medicine is not doing it, well, obviously it's not scientific. Well, we were able to show that was not true, that there was plenty of science.
Right.
And that's, of course, why we got credited.
Right.
The other part, and this is kind of dawning on me now, newly dawning on me, is I'm really pleased with the nurturing I've done for the future leaders in this field. So many of the people who were my students, and something I started doing a few years ago, I want to thank past president of Bastyr, Mac Powell. He had encouraged me to start doing student leadership dinners in our home about 6 years ago. So my wife Laura and I have been providing these dinners for students and talking to them about, where is our medicine strong? Where is it weak? What has to change for us to become a more important part of the healthcare system? And how can you be a part of that? Wow. And now I see so many of the students who are going through this process now in leadership positions, not just in naturopathic medicine, but in the other supporting, or might say compatible fields as well.
Yeah. Just planting all of these seeds and watching them grow. That's got to be rewarding.
Yeah. And I would count myself as part of that. And I can't say thank you enough to the leadership and guidance that you provided me just through education and just by everything that you've accomplished. So,
thank you.
Yeah. You recently published the 5th edition of the textbook of natural medicine, which is a treasure trove of information, as you were describing, even if it's with its 1st edition and now it's to the 5th edition. How do you know when it's time to do? I was just wondering this. How do you know when it's time to do a new edition? Is it based on periodicity, or is it sort of like, okay, it's now's the right time because this piece of information came out, or what is it?
There are 3 key factors. Number one is, if I had my druthers, I would update it every year. Yeah. Because that's how fast the research is coming out. I mean, there's 100 studies a month just on vitamin D. Okay. Right. So there's just lots to be done. But there were 2 big limitations. Number one is time.
Yeah. Right.
So basically, every update is about 2 years of work. This is not easy. I mean, we have over 100 authors, and this latest edition is in 2 volumes, almost 2,500 pages, full color graphics, and about 20,000 references. That's a lot of work.
Yeah.
And the third limitation is publishers. The whole publishing industry seems to become less financially viable. I think it's because some big publishers ate everybody else. Anyway, so the publishers aren't as willing to do new textbooks, nor is it willing to republish them. So realistically, we're at about a 7-year cycle, and that's slower than I would like, but that's the reality of the world we're in right now.
Interesting.
Yeah. It's an amazing textbook. We have it on our shelves here in Medical Affairs, and several of us on the team have contributed to the latest edition, so we're honored to be included. But if we can get into just a couple of clinical questions. You recently wrote a book called The Toxin Solution, and part of our training and focus as integrative practitioners is in toxic exposure and detox. But what inspired you to zoom in on environmental medicine in the recent years?
Another great question. So obviously, as a naturopathic doctor, I've always been aware of the role of toxins for the public. But something changed. So way back when I was practicing in the late 70s, I would see patients coming in where their toxicity would be cigarette smoking and working in some kind of industrial situation. Or my first 2 patients with leukemia were working as farmers, you spraying these toxic pesticides. So I was always kind of aware of it. But I didn't realize how significant it was until about 10 years ago. I was working on a corporate wellness program in Canada. So one of the wealthiest men in Canada, self-made millionaire, asked me to develop a wellness program for his employees. So he had 4,500 oil field workers. So I said, okay, fine, I'm willing to do that, but I want to be objective about this. So I want to measure people for toxic load. I want to measure nutritional status. I want to measure physiological function, HbA1c, homocysteine, the obvious kinds of things.
Mm-hmm.
And I asked him, how much can I spend? And he said, blank check. If I could convince him it was a worthwhile test to run, he would pay for it out of his pocket. So I did about $1,500 of lab tests on 4,500 oil field workers.
Wow.
Okay. Now you might say, well, wait a minute, oil field workers,
Right.
oil industry, toxic exposure.
Uh-huh.
No, these are guys who in the morning get up in a pickup truck, drive out to prairie in Alberta, and they check to make sure that the pumps are working properly.
Okay.
They're not being exposed to anything other than what other people are exposed to.
Okay.
So anyway, I found all this toxicity. I said, wow, this is surprising. And I found a lot of unrecognized diabetes. So I started looking at, boy, there's more diabetes here than when I was in medical school. Because when I was in naturopathic medical school half a century ago, diabetes affected a little over 0.5% of the population. And I would say, wait, I'm seeing way more diabetes. Then I started looking at the data and saying, diabetes has already been, and this is 10 years ago, has already been diagnosed in 7% of the population. And nowadays they're saying there's going to be 1/3 of people are going to get diabetes in their lifetime.
Wow.
Yeah.
What happened? So, I knew that genetics didn't change. And so then I started looking at the causes for it. And one, of course, is I looked at sugar because I thought immediately that must be what it is. And the reality is sugar excess consumption, which is real, it started way before the diabetes epidemic. Then I started looking at things, how about environmental toxins? Because I've seen all these environmental toxins in these people in Alberta that I was studying. And I was saying, that's interesting. People in the top 10% of body load of organochlorine pesticides have over a 12-fold increased risk for diabetes. I thought, that's interesting.
Yeah.
Then I started looking at toxin after toxin and realized, wow, it looks like the whole diabetes epidemic, or at least 90% of it, is due to environmental toxins. Now, you may be saying, wait a minute. Everybody knows obese people get way more diabetes.
Right.
And it's true, obese people do get way more diabetes. But if you differentiate people who are obese according to their toxic load, those in the bottom 20% of body load of environmental toxins have no increased risk for diabetes.
Interesting.
I just say, everybody knows obesity causes diabetes, but if the fat is not full of toxins, they don't get the diabetes.
Wow.
So, that's interesting. So as I started looking at chronic disease after chronic disease, I was finding that the primary driver turns out to be environmental metals and chemicals.
Wow.
So then I realized, okay, time to tell people about this. so I wrote my book, The Toxin Solution, and it's a little different than most books on detoxification. And as I first off, of course, said, here's all the disease due to environmental toxins. But then I say, but before you go on a detox program, you must open up your organs of elimination. So there's an old naturopathic concept called demunctories. Okay,
Yep.
How does the body get rid of toxins? And so I say, you got to get your gut working properly, you got to get your liver working properly, you got to get your kidneys working properly. Then once your organs do detox are functioning properly, now we can go on a detox program.
Yeah, absolutely. It's so funny because if you don't know, so Patty was an internist in a hospital for many, many years. And then she came here to Genova, work with a bunch of naturopaths. So she's had to experience us bending her ear and talking about the emunctories for...
I actually said,
Great.
what in the world is an emunctory?
So
I learned quickly.
Absolutely. Well, when you think about everything that we're exposed to on a regular basis, I mean, it can become really daunting. Like, what are some helpful takeaways to help protect ourselves from exposure and the negative impacts? Like, what are some of the key exposure windows that we can try to avoid as much as possible?
Yeah, another good question as well. So, obviously, we started looking at this and looking at the toxins in the environment. There are about 100 metals, metalloids, and chemicals in the environment at high enough levels to be causing human disease. So you say, okay, you can't deal with all 100, so you have to deal with the most important ones. And some of the things I've found have been just shocking. So let's look at lead. Everybody knows lead's bad for us. And everybody knows that, wow, we did a great job way back in the 70s deciding, let's stop putting lead into gasoline, stop putting it into our paint, stop putting it into lipstick, et cetera, et cetera. And so people's body load of lead has dropped hugely, about 80% in the last almost 50 years. Okay,
Wow.
good public health effort.
Mm-hmm.
But remember, people who are now older people, anybody over the age of 50, they built their bones when the environment was full of lead.
Oh,
Yeah.
right.
So now what happens when people go through andropause and menopause? They start losing bone. And as they lose bone, they release that lead into the environment. So a study just came out a couple of years ago where they then looked at, well, can we correlate lead levels with all-cause mortality and death from cardiovascular disease? And can we go further to determine what percent of cardiovascular death is due to, and all-cause mortality is due to lead? And these researchers showed that 18% of all-cause mortality is due to lead, and 1/3 of all cardiac mortality is due to lead.
Wow.
Well, I thought, wow, that's interesting.
Right.
Then the next one I saw that was fascinating was arsenic. Most people don't think about arsenic as, a problem. Well, it turns out that this is based on a study that was done in Italy. It was one of these studies I really like because it was a 20-year, 20,000 person prospective study. So it's not, looking at where people are now and kind of going backwards. Just that, let's look at where people are. Let's follow them over time.
Mm-hmm.
And they found that arsenic was a substantial cause of stroke, cancer, diabetes, etc. And they determined the threshold for how much arsenic has to be in a person before it starts getting a bunch of disease. And if you then look at the number they came up with, and then look at the level of arsenic in humans in the United States, it turns out 35% of humans in the United States have arsenic. So right there, two toxins, lead and arsenic, which everybody kind of knew are bad, but didn't realize how common the problem they are. It turns out they are a major cause of death and disease. So I think we should change the standard of care. You go into a doctor's office and you do CBC and check your cholesterol.
Right.
You know something? Check their lead and arsenic because it's more important than any other thing you're measuring right now.
Wow, that's interesting.
Wow.
And I'll say that, on our nutritional testing, we do lead and arsenic, and it's very, very common to see elevations in lead in people who are of age where they might be suffering from things like bone loss, osteopenia, osteoporosis. We see it all the time. So I completely agree from an empiric standpoint. I've seen that.
We see it. every day.
I'd love to work with you on a study. I'd like to publish a study in IMCJ showing exactly that. It would be great to look at your data sets and do a correlation between age and the blood test you find with lead, and let's see what you've got. Let's publish that.
Yeah, that sounds
great.
That sounds
That's
excellent.
great. Well, it's incredibly depressing to think about, right? So how do you keep people from becoming overwhelmed by this toxin anxiety and being fearful to live in their world, in an increasingly toxic world?
That is a very good question because I actually experienced that challenge myself, and that is, it's easy to get paranoid.
Yeah.
But it's for good reason because these toxins are causing a lot of disease, and what makes it even worse is, remember, these toxins are not occurring in a void; they're occurring in a population with multiple nutritional deficiencies.
Yeah.
Many people are not only below 100% of the RDI. Many people are below 50% of the RDI. So once you're nutrient deficient, your sensitivity and susceptibility to damage from the toxins goes up dramatically.
Yeah. Yeah. And those toxins or those nutrients are so key in helping to the body to process these toxins, to deal with our phase 1, phase 2 detox and things like that. So yeah. Switching gears a little bit, you've also recently spent a lot of time researching and analyzing COVID-19 from an integrative perspective. You recently co-authored an article titled "Evidence Supporting a Phase Immunophysiologic Approach to COVID-19 from Prevention Through Recovery." Can you talk a little bit about how much work kind of really went into that incredibly thorough article? It's really great.
Well, thank you. So as you know, there were 4 of us on there, doctors Sam Yannick, Carl Fitzgerald, and Helen Messier. So we've got ND, DC, MD. Okay, so nice balance.
All covered.
So we each kind of looked at different areas, and we dug into it, and it became very clear to us that number one is natural medicines have a huge role to play at every phase of the COVID, the SARS-CoV-2 infection, prevention, infection, cytokine storm, and recovery. But it was also very clear that what may be appropriate intervention, natural medicine intervention at one stage, is actually contraindicated at another stage.
Hmm.
So we try to go through and look at which natural therapies you use for each stage, and which ones should you not use, and kind of what are the differentiations to help you figure out where you are and what to do about it.
Yeah, it's really great. I love how you break down those different phases, like you said, prevention, infection, inflammation, and recovering. And you map these 5 targets of support across of each of the 4 phases. And some of those are things like support natural killer cells, support Th1 cells. From the standpoint of prevention, what are some things that we can all be doing to just lower our risk of severe or more severe complications from the infection?
So the good news is that there's actually a lot we can do. And in my doing my part of the of this article, I dug into research that actually led me to create for the first time a lecture called "Thoughts on a Unified Theory of Disease" that I presented at the IFM annual conference in May last year. Yeah. Okay. So out of that research came the following observations. So my job at that point, one of my responsibilities for the paper was look at vitamin D and the COVID infections, and of course it's very clear as the vitamin D levels go down, the COVID infections increase, and the severity and the complications increase, and ICU visits increase in direct proportion to deficiencies of vitamin D. That's very clear. The other one was a little surprising. At that time, it looked like, and I think it's true now, that the hydroxychloroquine is effective at the early stages of the infection and not effective at the late stages. Matter of fact, maybe contraindicated at the late stages. And the thought was the reason it was effective at the early stages was that the hydroxychloroquine was working as a zinc ionophore, getting zinc into the white blood cells, or into the immune cells, okay? And so we were saying, well, are there natural therapies that will do that? And I started looking for that and discovered that indeed there are a bunch of bioflavonoids and some carotenoids that actually are zinc ionophores, get zinc into the cells. And by the way, you're lab folks. I am hypothesizing that the reason there's such a poor correlation between serum zinc and white cell zinc is due to the lack of zinc ionophores. And I would bet you if you looked at the bioflavonoid levels in the serum and the zinc levels, you can correlate what's going to be the zinc levels in the white cells.
Interesting.
And I would love to see you do that. So another research idea for you folks.
We got lots to get.
I'm writing it down.
We got lots to do.
I think that could be really good. But it also makes me think now that zinc, white cell zinc, is actually way better than I thought it was. Okay, so I'm going to go back again. So anyway, so I was looking at all these flavonoids being good for zinc, for getting zinc into cells. And as I was doing this, I ran across this really interesting study. It was a supercomputer modeling study. So this is where they used typical drug discovery. They were looking at, trying to determine what molecules will bind to the SARS-CoV-2 spikes to make it less infectious. And they looked at 2,000 molecules. And it turns out that of the top 5 most effective at binding to SARS-CoV-2, at least in terms of the computer modeling, one was a carotenoid and one was a flavonoid. I thought, well, that's interesting. So I looked at these carotenoids and flavonoids and realized, number one is they get zinc into cells, and number two, there's actually laboratory and some limited clinical studies showing that they're antiviral. And I said, well, that's interesting. So what foods are these things in? And I found that I was looking at what foods they're in, and ran across a study that compared the flavonoid content of chemically grown foods versus organically grown foods. I'm no longer saying conventionally grown foods versus organically grown foods. I'm saying chemically grown foods.
Wow.
And what was interesting is that many of these flavonoids and carotenoids were not only lower in chemically grown foods, many of them weren't there at all.
Wow.
And then this idea occurred to me. Could it be that as we evolved as a species, we actually had 3 ways to protect ourselves from infection, not just 2? So right now we think about our physical membranes, mucous membrane, skin, and things like that, which play a huge role in just keeping the stuff out of our body. And once those things get into the body, virus, bacteria, whatever, then we have the 2 phases of the immune system, the innate immune system, which acts right away, and then, of course, the humoral antibody system, which takes longer to activate, but it's way stronger. What if between getting into the body and activation of the immune system were a bunch of flavonoids in our body that bound to the viruses to keep them from replicating?
Fascinating.
Now, they're not always going to get rid of them totally, but what if they give the immune system an extra day to rev up?
Right.
Think about the huge advantage. So I started thinking, oh, that's interesting. So we've lost these molecules from our food supply. We're seeing more and more frequent epidemics and pandemics. And sure, people are traveling more, but it could also be that their immune systems are more depleted, not just because of nutrient deficiencies that we know about, like vitamin D and C and zinc, things like that, but from deficiency of molecules we've decided, our scientists have decided were not important. So I'm thinking about writing an article on the unimportant molecules. So we've decided that there's only like 50, maybe 100 molecules in food that are important, vitamins, minerals, amino acids, and such.
Right.
There are 50,000 of these molecules in foods.
Yeah.
So we've thrown away 99.9% of the stuff that's in food, decided wasn't important.
Yeah.
That was a big mistake.
Yeah. I mean, in the face of COVID and this pandemic, it's reassuring, right? To know that there is something a patient can do to kind of stave some of this off. It's nutrition, it's avoiding toxins, it's all of this stuff that you've pioneered here in natural medicine.
Yeah, exactly. I was just going to say, like, so much of it is, the foundations of health is what we kind of get back to. And
yes,
that's, I just can't thank you enough for the work that you've done over these years.
So when we hear all of these things, Dr. Pizzorno, and we've seen your career, classic underachiever there. What can we expect next? Like, what are you working on, and what can we expect to see soon?
So theoretically, I'm at the retirement age. Actually, pretty far past it. But realistically, I'm at a point in my life now where, I've been doing this for so long. I've read so much research. I've seen so much patient activity. I talked to a lot of doctors. I'm developing deeper and deeper understanding of medicine. So my job right now is to continue to be like a transformer. My job is to look at all this research, see what makes sense, and then pass it on to other people. Yeah. So I'll continue doing that. But I think my next one is I want to re-flesh out my ideas on the unified theory of disease. Because it's pretty clear to me why people are sick. And it's pretty clear now what to do about it. So that has to be developed much more completely.
Yeah.
Awesome.
And that was a brilliant lecture that you gave, and I can't wait to see more of it. So thank you so much. And I think the only other thing is a little bit of a surprise question that I have at the end of the day. Do you have a favorite vegetable, Dr. Pizzorno?
A favorite vegetable? Well, I have a favorite fruit, and that's blueberries.
Okay.
I have a dozen blueberry plants that I've been growing organically now for over 30 years.
Cool.
So they're probably the best blueberries you'll plant anywhere on the planet.
Cool.
Oh, I'm jealous.
But in terms of a vegetable I like best, wow. Hey, Laura, what vegetable do you think I like best?
Nachos.
Nachos is not a vegetable.
I know, I'm being obviously facetious. Peppers.
Peppers.
You like spicy
Oh, yeah,
peppers.
that's good. Spicy peppers.
Oh,
Yes.
nice.
Excellent.
Nice.
I just, I'm growing more and more of our own food. And I just grew some new peppers that are the best peppers I've ever had. So I'm having a lot of fun experimenting with different kinds of pepper plants.
I love peppers.
Well, we could put the peppers on the nachos, so it kind of all comes
Yes,
together.
exactly.
Well, Dr. Pizzorno, this has been an amazing time that you've spent with us. We are so honored, and we're going to encourage everyone to check out all these books, including your textbook of natural medicine, which is a Bible and a staple for anyone in this field.
Yeah, absolutely. Thank you so much for your time, and we'll definitely be in touch and follow up with some of these awesome things that you suggested. So,
Well, thank you for the very kind interview, and again for the work you're doing.
Yeah.
This medicine has so much potential to help people regain their health, and we have to do everything we can to advance that.
Agreed.
yeah.
It was great meeting you, Dr. Pizzorno.
Thank you so much. I look forward to meeting you in person.
Man, that was a lot of fun.
Yeah.
I would encourage people to go look at some of the resources that we talked about, like the COVID-19 paper that was published, and certainly the textbook of natural medicine, and even his most recent book. So, what a fun conversation.
Why were we so nervous to talk to him? He's very calming and just so open and sweet.
That's true.
Why were we nervous?
I'm always nervous.
That's true.
I walk around nervous. I'm pretty sure I'm even nervous when I'm sleeping.
That doesn't make any sense.
No, it doesn't.
Well, what are we doing next time, Michael?
Next time on the Lab Report, Dr. Nicole Avina.
Yeah, she's a neuroscientist who specializes in sugar addiction.
What are you staging, some sort of intervention?
What? No. Who, me? No. You've been listening to the Lab Report. If you like what you hear, please subscribe to our podcast, rate us, and leave us a review. To learn more about Genova Diagnostics, visit our website at gdx.net. There you'll find information on specific testing, educational resources, and how to connect with our show. Call us at 1-800-522-4762 or email us at podcast@gdx.net. Speaking of hot peppers,
Yeah.
have you ever seen that
I love
show
hot
on
peppers.
YouTube where they eat the hot sauces, hot wings?
Hot ones.
Yeah.
Yeah.
I love that show.
I know. It's fantastic. What a great premise. You like get somebody's in their total
Yeah.
discomfort zone and then ask them a question. It's brilliant.
Why don't we do that?
Oh.
I'm going to challenge you to this.
Oh, that sounds like, that sounds pretty dangerous, but I'm totally up for it.
We should do a podcast eating escalating hot wings.
All right. I'm down.
All right.